There we go. We're
Okay,
live. Oh my gosh.
we're live, and it was really nice and peaceful after someone started using a power tool of some sort down the road. So hopefully that's not coming through too loud. We'll
Lisa's
see.
background is real. She's beaming
Yeah,
in
this
from
is
New
real.
Zealand, which is not yet a part of the United States of America.
It's not, or a part of Australia, which is controversial. They might actually put a hit out on me. Should be part of Australia, and even in the
Oh.
Australian constitution, I don't know how they do government there. They have a provision to basically optionally add New Zealand as a state of Australia. Just saying.
See, America, Lisa has opinions about every country's
That's
policies,
true.
laws,
I
and
do.
regulations. She's here for it.
I
Okay,
do. I do.
so
I do.
this is a special episode of the Health Tech Talk Show, which we just planned 10 minutes ago. So there was some stuff that happened. I don't think the show is going to be a whole hour, but we always say that and then it ends up being that way. But I think it's going to be a solid 15 minutes. Anyway, some stuff happened. So this morning I was like, WTF, Stefan Kanya? And he said this with his
And you
swag.
and you know what's not fair? We made it pretty clear that we wanted some of that vintage swag. And did we get it? No.
No. Although to be clear, I mostly said, hey, do you think I can get any? Do you think I can find some on eBay where you can find everything? And everybody was like, probably. But a lot of people were like, I don't know. It's kind of worded and soft. I'm into it. So I'm sad to report, America, we did not obtain any vintage ONC swag before it became cool again, which is today.
Yeah. Yeah.
Yeah.
Yeah. Very sad. Very sad.
Yeah.
So
So I don't know if I
again, we'll
can
just yeah. So they basically as predicted, as long predicted here on the Health Tech Talk Show, ASDP is no more. ONC is back. Baby.
It's back. It's back, as Stefan is proudly showing here. So that's great. I did see their logo on LinkedIn does no longer have the star.
Ooh.
I will say the thing I really liked about the ASTP situation was they did have a great logo, like that eagle. I'm into that. So yeah, it was almost like they used the Freedom Health Data Network's branding guidelines to help them do that one. But what are you going to do? I mean, so I'm trying to think of who made out.
Oh, it looks so boring now. It's just a blue.
I know.
Oh, come on, guys.
I'm wondering if
cool.
potentially they're paying a branding consultancy a couple $100,000 to bring it back, or if they're just you know what, we're just gonna use the PowerPoint format for our logo because whatever, who cares? Anyway.
Boo.
I don't know, but I was asking. Thanks, Stefan. We did ask for permission before using this photo, so look at us. I will say, I was talking to someone today about who. I don't know if that person's watching. They usually do, but I won't say who you are in case you don't want to be disclosed. But we were who made out on the transition from ONC to ASTP? I would say, much like in this case, potentially there's some branding companies that may win to do some art for LinkedIn. I think the transition to ASTP, the winners were some branding consultancy and probably Mickey Tripathi, who got himself a cool AI job because he was the acting chief AI officer for 20 minutes.
Yeah.
So
yeah,
I'd say those are the winners. I'm not sure there are any losers because I'm not sure anything ever happened.
I mean, if you recall, there was a lot of drama around because the other part of the announcement was that they are moving the chief technology officer, chief data officer, chief AI officer roles back into the office of the chief information officer, Clark Minor, from ONC, formerly ASTP, whatever it was. And there was a lot of drama around those people and selections because they were named at the end of the Biden administration, and then some of them didn't get seated at all. It was just this very confusing kind of situation. So I don't know that it matters a lot for those people necessarily, because I think those people, as far as I know, are all staying. They're just moving into the office of the chief information officer. As far as I know, no one said anything otherwise. But yeah, I don't know. I mean, the whole thing was confusing, I guess, is kind of what it comes down to. And now they're trying to make it a little less confusing. IDK.
Yeah, so that was what I was confused about. I was I thought that those offices were kind of acting autonomously anyway. And I mean, this is the thing, I guess no one cares about laws and rules anymore. I'm here for that. Everybody knows that. But yeah, I kind of felt this wasn't even, I kind of felt they were acting very autonomously. Like
Yeah,
in no
yeah, yeah, yeah.
circumstance did I ever think Clark
Sure,
Minor was
sure.
reporting up through ASTP, but
Mm-hmm.
maybe that
Mm-hmm.
was just his vibe. Like, I don't know.
I don't think he was. The office of the CIO was always like separate. I don't
Oh
know.
yeah.
I'm not
I
sure.
don't
Maybe
know.
actually there is consolidation happening because doesn't HHS have a different chief AI officer? I'm confused. If you know, tell us what's going on with those
Listen,
roles because we don't know.
you know what I think? I like, because I've like, I'm out here in the wild in the private sector where we aren't allowed to have 17 chief AI officers and 17
Sure,
CIOs and all
sure,
that.
sure, sure.
Like, I just think we need one of those. Like,
I
right,
mean, I
right,
mean,
yeah.
I guess I think like what's the point of it? So you actually see a lot of private companies now hiring like chief AI officers where they maybe didn't have someone before. First and foremost, unless there's some like very specific like compliance requirement, it feels to me like your chief AI officer is doing the job plus like what your chief data officer was doing before. And I mean, somebody, again, if you disagree with me, like please obviously tell us what you think. But like, I think it's data is the foundation of AI. There might be some things you do around like implementation of AI that are it's different, but it feels like that's all in the same sort of area to me. And fundamentally for like business stuff, it's about like implementation. Like how are you redesigning a workflow entirely using like advanced analytics tools like AI? I don't
Yeah.
know. I mean,
Yeah.
ugh,
Yeah. I mean, again,
AI.
we're just a bunch of girls out here in the great free private
Yeah,
sector, and one
yeah,
of us
yeah,
isn't even
yeah,
in the
yeah,
United States right now, so we could be
yeah.
wrong. I will say, so I just went to my favorite
True,
website in
true.
America, which is healthit.gov.
Is that your favorite website, Kat? I thought it was like
No.
cat fancy or something. Cats.
I once did send a bunch of people who hate cats subscriptions to Cat Fancy.
That's amazing. That's amazing. I highly support that.
Oh man, it was
Oh
so good.
man. I
Yeah.
love cats.
Anyway, there's a press release about this. I would just like to like the spin on this is like so good. Like I'm here for it. I also think like I mean the fact that we're doing a special health tech talk show on the fact that this happened is almost like it's super in our brain because it basically is nothing and everything all at once. But here's the
Right.
headline for the announcement.
Everything bagel.
It is like high drama. Okay.
Hmm.
HHS aligns health technology leadership to deliver data liquidity, affordability, and an AI enabled healthcare system for Americans. Mm.
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 Sure. So if you read Brendan Keeler, if you want some like real, if you want a more in-depth analysis of what happened, he went back and looked at
The
all of
smoke,
the, he said
the Pope.
right. He said he went back to like all of the previous like office reorganization announcements and he was like, they didn't change anything except for the name, which is like fine, right? Like, I don't know why you have to change the name. Like, I don't know what it does beyond being like the whole announcement is like the Biden administration renamed this. And so we're unrenaming
Yeah,
it.
so
And
fuck
it's like,
you.
fuck you guys. And I guess I just think like, okay, that's funny. Like, I don't know how, if it really, and I have not verified what Brendan has said, but he's usually right about these things, having reviewed all the past information versus me, who just like looks at the headlines, and Kat, who just looks at the very top
Vibes.
part of the headline, the
Vibes.
vibes.
Mostly. It's mostly whatever people tell me when I text them.
Right, right, right. So like if it is really just that they pretty much just like renamed it again, like took away the ASTP designation, and then moved those like chief whatever offices, then it's fine. Like nothing burger, right? Seems
Yeah,
like it.
I don't really know. I will say Steve Posnack did put an epic one of his normal dad joke posts on the LinkedIn where he goes, "You
Dad
down with
jokes.
ONC? Yeah, you know me. Name that '90s
Oof.
tune." And no, I will not be singing that as karaoke. Just call us
Steve,
ONC. Just this is the
Steve,
great line though.
Steve.
Just call us ONC like we all kept doing anyways.
Which is what you kept doing anyways.
Well, I mean, like I have a hard time, like even when people get married and change their names, like I can't,
I know.
I'm just
I
like,
know.
what? What was I
Not
supposed
good
to
at it.
do? Like rebrands, companies that change their names. I just like can't even. I still call it Twitter. I still call it Twitter.
I still call it Twitter
You know
too.
what
I
I'm
always
saying?
will. Always have,
Yeah.
always will.
So I don't
Always
really
have, always
know.
will.
I feel like I'm not concerned. Although I will say, well, I have two observations. One is not important and not thoughtful, and that is that clearly national coordinator is a cooler title than assistant secretary.
I mean, is it? They're all not
Okay.
cool. Sorry.
Okay.
No
Yeah. I mean,
offense,
in
Tom.
the realm of like
Sorry.
dumb titles, right? Like, I
No
don't
offense,
know.
Dr. Keen, but I think both titles were kind of dumb. Sorry.
Assistant is like just a demotion, no matter how you look at it. Like, why aren't they associate?
Yeah, but coordinator is also like a dumb name too. No
Also,
offense. Again, sorry,
secretary.
Dr. Keen. Sorry.
All these, I mean, Lisa, it's like these freaking government titles were made up like in our founding years in the
They
1700s. Like,
were. They
I'm
were.
so
They were.
confused. Like,
They
yeah,
definitely were.
it's
They
so dumb.
definitely were.
Assistant secretary, what? That is like, you're like, no, I
They used to
know.
have like commissioner. It depends on like
Commissioner's
there's a
a
whole
cool name. Yeah.
commissioner's like fine-ish. I don't know. Yeah. Okay. So other stuff that happened beyond that, OpenAI raised $1 gazillion or something like that
To
just now.
surveil Americans. I
Yeah.
hope you all
Yeah.
have canceled your OpenAI subscriptions and moved
Yeah,
them over to
dudes.
Claude. Just saying.
And and at the same time, Claude Code, all of the code was hacked. They like apparently Claude wants to be free, I think is kind of like the best way I can put it. And all of the source code for Claude Code somehow like got leaked by Claude itself again. And apparently it's the second time in like a couple of months. So I think Claude wants to be free. OpenAI is continuing to surveil Americans, like definitely, whatever, like do with that what you will. Um, Oracle.
Why do we say that? We say that because like the day after the Claude CEO was like, Anthropic was like, F you, DOD, we're not going to surveil Americans. The next day, OpenAI was like, signing a
We
deal.
did it. We signed the agreement. We have no such concern. Yeah, that was fun. So this is all allegedly, just to be totally clear. Oracle laid off 30,000 people and blamed it on needing to spend more money to build data centers.
That's right.
Um,
Do we know if they just like totally slashed into the Cerner acquisition, or are those
It
people are
said that
dead?
Oracle Health was included. I haven't seen any other rumors. So if you have any other good goss, like definitely share it with us. Like
I don't have the
who
hot
got laid
goss.
off and why. Yeah, like
I
it's
think
not, I mean,
they're all on Reddit. Like the Cerner people are
yeah,
all on
yeah,
Reddit.
yeah. Yeah,
We
yeah,
gotta
yeah.
go there. Maybe we should ask Claude to go to Reddit,
Hmm.
check it out for us, see what's up. I don't
Yeah, yeah,
know.
yeah.
Um,
And then I have a new theory that I'm working on that I want you to think about, and I want everyone to collectively give us tips and give us your thoughts about this. Okay, so CMS also today, because HHS doesn't care about my vacation, clearly
no
on
girl.
vacation, trying
Nope.
to be on vacation, is they
Is it
released
most
the.
of DC on spring break this week too?
Totally.
Yeah.
Like F you and your dumb vacations. Everyone's at office. So they released the LEAD model RFA. So LEAD is the new accountable care model that's succeeding, like coming after ACO REACH and kind of trying to get more providers and ACOs who were in MSSP. So they released the RFA today. It's due on May 17th. And it's this massive, massive new like redesign, like has the 50% capitation or 100% capitation full risk. They're trying to get providers into those higher risk models. But I was just thinking today, like thinking out loud clearly, like, okay, the goal is to get, and they said in the RFA that only 20% of TINs, that's like taxpayer identification numbers, so providers, provider groups, and only 45% of beneficiaries in Medicare, original Medicare, are in accountable care relationships, which is really bad if your goal is like 80+%. Well, we had talked about MA, the future of Medicare Advantage. And I'm kind of was like, what if CMS just like redefines MA as like lead? What if they just move Medicare Advantage in the direction of lead and move ACOs in the direction of MA? What if they like are thinking about merging it
When
in
they
some
have a
way?
baby.
Could they have a baby? Like, that's what I'm thinking. Like, is there a vision to like, because they're like, well, what are all the ways we can do to get like Medicare beneficiaries in like accountable care relationships where there's downside risk, there's some kind of like, you're responsible for their entire care, blah, blah, blah. They've been ratcheting down MA and like ratcheting up ACOs. What if there's going to be like a big merger
Like a
of some
merger
kind?
baby. I mean, it could
Think about it.
happen, right? Because like Lisa, I know everybody's been all stressed. Everybody stresses about everything that Chris Klump says, which I think is great. Good for Chris. Like,
Yeah.
that's
Smart
cool.
guy.
But Stat did publish that little hallway conversation they had with him after the
Yeah.
recent summit in New York, and
Yep.
implied said also maybe actually said that like maybe the default enrollment is Medicare Advantage for Americans. I don't know. I don't know if that's true or not, but I mean, maybe you're right. Maybe they're just doing it. What was the date by which they said they wanted 80%? 2030 or like, was it like 2028?
I think it was like 2030, which is real soon.
Oh, we got plenty of time.
No, we do not. There's so much. It takes so much to get these things off the ground, man.
I
It's
don't
like
know.
ooh.
Lisa, it's like
There's always,
barely
yeah,
2026. That
yeah.
is
I
another
mean,
president's problem.
that's true. That's a true statement. That's a true statement. But
Yeah.
like it's a really basically like it's a really tough decision right now for these providers who were in the previous ACO levels. They have like a very short amount of time to figure out like what do they do, which program do they go with, because they all have like application periods coming due soon. They all have like all these overlapping things. Like it's very complex. And the lead model in particular has a bunch of like very tech forward things, including a proposal around the use of AI in risk adjustment that's being
Mm,
tested in the model. So there's a bunch of stuff there to like get your head
yeah.
around. And I don't know how, because reading is hard. It takes a long time and not a lot
It
of people do it.
does. But don't you remember
Yeah.
when I was complaining when we were interviewing Abe Sutton at Vive and I was like, oh, these rules are so long. And he was like, why don't you just put it in an AI and it'll tell you? And I was like, because I have Lisa, like, shut up. But like,
Because it's not always right. It's not always right.
it's true. It's really not.
Claude makes up a lot of shit. It really does. And the problem with Claude and whatever, all these tools is that you can only figure out if it's not true if you already know what's going on. If you're like a beginner, you'll never know. That is a
Yeah,
problem.
it
Nobody
is
has solved that
crazy.
yet.
I will say, like we do a lot of like RHTP consulting and like random Medicaid consulting. And a lot of that is
Hmm.
like knowing who you know, who's telling you the real thing. And especially because states will do
Uh-huh.
stuff differently. I've probably been on in the past 2 weeks, like 4 or 5 like new client calls. They want to do this stuff. The shit they tell me is like so far from true. I'm like, how did you find this out? And they've got someone who just
AI.
like, they were like, well, we're a small company. We just said like, go tell us what. I'm like,
This is the
wow,
problem, man.
that
You need
is
some
so
discernment and you need
wrong.
some knowledge. Like you need some knowledge, and that's a whole thing. Like, I don't know. Oh, the other thing about lead, which is interesting to you, is that they also plan on testing a like Medicaid integration with 2 states. So CMS said that they're going to solicit applications, or they're going to try and get 2 states to be part of a ACO Medicaid Medicare duals integration thing. So like there's a whole piece as well. Lead to me feels a lot, after having looked at it for a while, feels very much like a health policy nerds grab bag. They're like, what if we tried this? What if we tried this? Put it all together. Like it's a
Yeah.
very it's an interesting one. So we'll see. It's a big swing, I would say, from CMS.
I think that's great. Plus, also, it's not like what was that? Oh shit, what was it called? What was the thing called before? Was it direct contracting or was that after?
Direct contracting was renamed ACO Reach
Okay,
by
yeah,
the
yeah,
Biden
yeah. Okay,
administration.
okay. But direct
Yeah,
contracting
they
was
made
like pretty great, but then Biden was like, screw that, and then now I don't know. Like it hasn't.
no, they kept the fundamentals of direct contracting. This is the thing. Like the secret with all of this is that like CMMI in particular and accountable care more generally is like something that almost all administrations have agreed on. Like how aggressive you want to get is maybe a little bit of a question, but like everybody from CMMI and from that part of CMS is like, oh yeah, we gotta change it. We gotta push this curve down. Like people are pretty well aligned, including the
Yeah.
previous directors from CMMI. Like there's a good amount of alignment about like what we're doing. Maybe a few things different, but like there's a good amount of alignment.
Well, that's good. And even if there's not alignment, this one has a few years to like take off, which is great. Hey, also things that happened yesterday was the deadline to submit your Crush RFI response if you like
Oh
crushing
yeah,
fraud like we
that's
do.
right.
So that's great. And there was also we covered this when you were out, when you were on an aeroplane over the sea, but there was like a really
Trying to
interesting
make my Wi-Fi
article.
work.
Yeah, well, yeah. Well,
Mm,
but we were talking
in and
about
out.
that the autonomous
Hmm.
AI upcoding, particularly on sepsis, and how
Yeah.
Massachusetts, it's like 3x'd in a few years, like the number of sepsis cases, but it's like all fake. Like it's all just like upcoding.
That's grim. That's grim. I mean, you have to like one of the things that we've talked about generally is like, yes, AI can help with some of this stuff. I think people have said like, what it's showing in general, not when it's like incorrect like that. What it's showing is that, primary care physicians don't have time generally to like code everything correctly. Like by that, I mean like code all the things that are happening in the visit because there's so much going on. So like on the one hand, like we should be able to see all the things that primary care are doing in actual office visits. On the other hand, like it can't result in like an inflation of the cost of care that isn't warranted. And so it's a tough one. Like I mean, I think fundamentally these systems have to be designed where there is like documented evidence of the thing. Like you can't just say like it sounds like sepsis. You have to show, like you have to prove as well that something that you coded is actually accurate. So yeah, fully autonomous is probably not in the books.
Yeah, maybe not the move. I don't know. Other things that happen. We still don't have a CDC director. Apparently, it's cool that we don't. Like, I know there was that. You were telling me about that rule, Lisa. The 211 or 12 or 15 or 17 days.
Bhattacharya cannot be. He's not. I think he's like no longer the official CDC director. He's like
but he's
the like
unofficial
default CDC director.
Like I think. Oh, it turns out that deadline was like, I mean, real but not real at the same time. So funny. I don't know.
Yeah. It's a good time.
But you know what? I hope they find a good one. Also, it looks like Casey Means is getting pulled. Doesn't have the votes. Doesn't have the votes. It does seem like Maha is like no longer cool. Like I was in DC last week, and they have the big Maha mural.
Yeah.
That they painted, and I was
is
like,
it gone?
Ooh.
It's still there. It's still there. Okay.
But I'm into the vibes. I did not feel the vibes.
That would be the funniest part if you showed up and the mural is gone.
Well, yeah, I'll see it again on Thursday, so I'll let you know if it's there. I'll take a picture.
See if someone spray painted over it. Like,
no, I just feel like the vibes are gone with the Maha thing.
Yeah.
Although when I was screwing around on my other favorite website, hhs.gov, and I saw it was America's birthday, and I clicked on the 250-year celebration link, I believe the opening video animation thingy is RFK fly fishing in jeans in the water.
Oh my!
So
yikes.
I guess he's still someone's still into that guy. I mean,
he's doing his thing. He's doing his thing.
Doing the thing.
Nice.
I mean,
nice.
I did just listen to or maybe it was like a video interview or something about how he's on a very strict diet. He eats meat and ferments. He eats fermented food. Which, like,
that's
honestly,
what you eat.
I'm into it.
I feel like that's your diet.
I also eat non-fermented veggies and stuff, but yeah, I was like, like I'm into these things. I just feel like they went too hard on like the crazy stuff.
Yeah, I mean, fundamentally, I think that the vaccine thing just proved to not be very popular with the majority of Americans. Like, a lot of people were like, that doesn't quite, like, I might have some questions about the COVID vaccine, but I do think people should not have measles. Like, I think that's like the general vibe, right? Like, that's not me, just to be clear. As you know, I love the COVID vaccine and mRNA vaccines in general. But I think the general vibe is like, that's a little too far. Maybe we don't want polio or measles. Like, it was good to not have. So,
yeah. Well, and like we mentioned last week too, I don't know if you were able to hear it on your airplane, but Popeye, our friends over there, including Ann Zink, they now have a measles dashboard, so you can see where the measles are. You can stay away. You need to.
Ann Zink is such an American hero and just shows you how you can be a super awesome public health advocate and also potentially be a Republican. And those things are not in conflict, and that's fantastic.
And not just like whine all the time. Like Ann does stuff, which I'm totally here for.
She's like, well, let's connect this information.
Yeah, she's like,
what's up?
There's not a lot of measles, or it's the cost of doing business. Let's see.
Let's see about that.
Let's see what's going on.
I just love it. Yeah, love people who anchor in the data, who are just like, who try to push through like ideologies and just, that's just fantastic. So big shout out, honestly. Big shout out.
Yeah, I mean, the whole like Maha thing, I mean, who knows? Maybe suddenly I'll feel the vibes again, but like, the whole Maha thing is like an excerpt. Like, how like all the Republicans, they were all like, wah, the Democrats went too far on the transgender stuff and, shared bathrooms, blah, 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 sports, whatever. Like, honestly, y'all kind of did the same thing with the vaccines. Yeah.
Yikes.
Yeah, you did the same thing. I don't know.
Vibes are shifting.
I don't know why we can't learn lessons here. But anyway, whatever. We got ONC back again. Let's ask one more question for our loyal, let's debate this for our loyal fans. Okay. It clearly cost taxpayer dollars to un-ASTP the ONC.
Was it worth it?
Why did we like? Was it useful? Like, I don't like. Why did this really happen? Just because everybody
I
was
don't. So I think that we had asked this question back in the day when it first happened. We were like, "Is there additional money? Are you guys getting additional money?" And I think there was some additional money. It's not a lot though. The amount of money that ASTP ONC has slash had.
it's like not a lot.
It's a lot for I don't have $10
It's
million
more
dollars
money than I
personally,
have.
but like it's not a lot in terms of running, this massive entire Department of Health and Human Services. And I'm getting a phone call. Decline. Well, here we are on
What are you gonna
vacation.
do? We're very busy.
And we're very busy. It was a phone call from my more or less stepmother about giving us a ride down to the other part of the island. So big important things here. Anyway, the money is not very much, but it was a little bit more. So maybe they were able to claw back a couple $1 million. Like but again, that's like chump change in terms of what HHS is spending. And then by the way, we all believe really strongly that ONC needs more money to do enforcement around the no information blocking rule, which I realize is partially OIG's job, blah, blah, blah. But ONC also has to do stuff and they should do more of it. And we need them to enforce the no information blocking rule. We need them to, do a bunch of things, right? Like, it's just like they have a lot to do. And I don't think it was a big amount of money, but maybe this is my hypothesis. Give us a signal if you agree, disagree. I think maybe they clawed back a little bit of money. Not really sure.
I don't know. I know, I didn't read the whole Federal Register. My other favorite website, the Federal Register, did not see all those things. But I also didn't actually read it. So I read the headline on the press release and the first 2 paragraphs of the announcement. But I don't know. I'm kind of just like, why? Well, I mean, I get why Mickey wanted to do it because, power. Excitement,
it definitely increases
drama.
the visibility. New cool logo, which we obviously supported the cool logo.
Please bring
but
that logo
I just
back.
don't. Yeah, just bring the logo back. Like you actually, by the way, that's recycling, right? You already spent the money for the new brand. Like just use it. It was better than the stars. The stars were very old school in not a good way. Yeah. Eagle is a great thing always, and we support it.
It's very 2010.
Yeah. So I guess maybe they clawed back a little bit of money. Not totally sure. It's a very small amount in the grand scheme of things. And by the way, ONC needs more money for things around implementing no information blocking and implementing HTI-5 and HTI-6 upcoming. And they need they actually have it for a few dorky health IT policy nerds, a really important mission they have to fulfill. So let's not look away on that one.
Yeah, I was actually a lot of this dereg stuff, I'm totally into, right? But I was thinking about the HTI-5 stuff, and one thing that's a little crazy, the screen scraping, I don't agree with that because I think that's kind of shitty and also violates a lot of stuff out here in the great free private sector. Also, I'm over that. Whatever, go ahead. But the crazy thing is what about the bots, the autonomous bots that can go in and write back, and they're removing the audit requirements in HTI-5. So that's
auditing is important. I like auditing. I want to be able to audit where my entire everything goes.
As a vendor, I don't want to audit shit. I'm here for not auditing. I actually think that's great for the industry. But as a patient, I feel or as a provider who is semi
as a patient or provider, you would want that.
Wouldn't
you want
you want to know if the bot said you were pregnant or exactly. No longer pregnant and you were pregnant and there's maybe I don't know, you're in Texas or Arkansas or one of those states or my state, the great state of Georgia. I don't know. I just would want to know. I would want to know how that happened.
Wow.
What do you think? Yeah. I don't know. But so I don't know if more staff would, especially with AI land coming along, would now I'm so excited we get to call it ONC and it's
ONC.
I'm actually I shouldn't have said ASTP. But don't you think would they be responsible for making sure that the bad bots are at least tracked?
Something like that, right? I don't know. I think there's a whole, there always has been a missing enforcement piece in all of this. And, I heard that they were, maybe they're going to take that money and give it to OIG to do more enforcement.
Oh, yeah, maybe.
Who knows?
Yeah.
Like these are all things that if you had information about this, you could send us a signal message
You could
and
send us
tell us what's going
everything.
on, and then we would tell other people if you let us. So you just let us know. You just let
Yeah.
us know. We're
I will
always open for
say,
tips.
we actually don't tell secrets that people haven't told us we can tell.
Yeah, we don't.
Which
We're not doing that.
normally, like, someone's like, you should do this. And we're like, okay. Yeah, but we're not like a bunch of narcs. But
We're not a bunch of
I,
narcs.
I would like to know. I would like to know what that money. You know what we also need? We need more friends at OIG.
We do. If you're at OIG and want to be our friend and somehow watch a stupid show like this,
Everybody
you
loves
just let
it.
us know.
Everybody
Just let
loves
us
it.
know.
Everybody
Just let
loves
us
it.
know.
It's true.
Yeah.
Okay. Well,
All right.
anyway, Abe and Chris Klump, Abe Sutton, Chris Klump, watch our show and make Medicare Advantage and ACOs have a baby. That was Lisa's idea. Tell us how it goes. We would like to be there for baptisms and things like that. Whatever, you know, all those parties will come for that. Also
This
invite
might be a good idea. This might be a good idea. I'm not sure yet. Like someone will tell me why it's not, but like it might be an actually good idea to solve some problems
there's
here.
always going to be
Just saying.
something wrong. It seems like this administration is all about just doing it. So I think we
Just
could.
like making healthcare technology and AI deflationary, I may have had another good idea or not. Who knows? Who knows?
Oh yeah. Oh wait, Lisa, before we go,
Steal this idea, please, because I think
somehow
it's yeah. Please steal this.
we have been talking for 31 minutes, despite the fact that we said we would talk for
Great,
like
great,
10.
great.
What do you think of that new advisory committee list?
Yikes, man. I don't know. I mean, just saying that there were 400 people who applied. I didn't actually see how you could have applied. I probably would have applied just for
Wasn't
fun.
this that
Um,
big? Or was
yeah,
that a
it's
different
been
committee?
it was rumored for a really long time. It was rumored for like a couple years, it feels like. And there was like information from like a year and a half ago about somebody who was like gonna be selected for it. So I don't know like the fidelity of that list or whatever. Maybe there were two different ideas that got merged at some point. I'm not sure. Again, if you have any information, you can certainly let us know. I think I know that on the show last week, Erica was like, "Hey, are there like any patients?" You know, generally just like asking questions about who got
Just
this and
asking
why.
questions.
IDK, I'm really not, but I do know that there were, and it may have been that there were multiple like advisory groups that were planned, and then they got kind of merged into one because I heard about some of those people being on one of these advisory groups like a year and a half ago or whatever it was. So I don't know if it's like I don't know if this is the same thing, if it's something different, if they merge two things, but I'm not sure it was super, super transparent. I'm also curious how they're going to use them. Obviously, if you're new to this space, like these advisory committees, like can sometimes just chug along for centuries without any kind of impact. It's not always clear
Yeah.
like how they're being used. Like HITAC, which has returned.
Non-binding. High tech is back. Yeah.
Non-binding.
Yeah. It
Yeah.
said like non-binding recommendations or something like that. Like, I'm here for that. Love advice. It's basically like being on the board of every nonprofit.
Yeah, it's kind of like that. It's a very formal structure that requires that requires the government to take input from the private sector in particular ways. So that's a good idea, but like there's not like you just said, it's non-binding. It's not a whatever. So
Uncool.
TBD what that looks
Uncool.
like.
Yeah, we'll see. But yeah, I think that yeah, maybe everyone's going to listen to us about some of these suggestions. People do think we have some influence, Lisa. As you know, like someone
I
thinks
just have ideas that I say while being live streamed to the internet. It's not like good or particular. I just have you turned on the live stream and I started talking. That's the only influence.
Yeah. Well, then people take your ideas and then get quoted in major media outlets, which is
Good for
cool.
them. Good for them.
Also, like, as you know, there are people who think that like you and I, but I guess mostly me because I'm meaner, provided a list of people to be fired from HHS, which like, okay.
Oh, wow. Did you?
Oh, I don't know enough people.
Stefan, watch your back, buddy.
Watch out, we're coming for you. No, Stefan's great. But like, okay, so I wish I had such power.
Yeah, I don't have no one's ever asked me for a list of people to fire. I could make a list, just not at ONC specifically. I could make a list. If you wanted me, if somebody said like, Lisa, you are the king for a day, like I'll do it. I'll do it. But nobody has asked me that yet. So
Yeah, I mean, let
tragically.
us know. Like if you're still taking suggestions. I think April 1st was the riffs last year. So I mean,
Ooh,
again, I don't really know a lot of people.
grim.
Like, but we could try. Let us know. Let us know.
Grim.
Let us know. Okay. All right, Lisa,
All right.
you're going
Gotta
to do
go
stuff during the
to
daytime.
kayaking. Bye,
Okay, I
everyone.
gotta go make dinner.
Yeah.
Yeah.
Please do
Okay.
not, please don't make any more changes, HHS, until I get back from vacation. Thanks. Bye.
All right. Bye, America. See you
Okay.
later.
Bye. Bye, America.